Your blood pressure can stay dangerously high even while you take your pills every single day. And one of the reasons is probably hiding in your kitchen, your medicine cabinet, or your bedtime routine. If you want to stay healthy and independent as you age, hit that subscribe button right now. We share simple, science-backed health tips like this every single day. After years of reviewing senior health research and watching the same patterns show up again and again, one truth stands out. Medication helps, but medication cannot outwork the wrong daily habits. That is where so many people get stuck. They think, I'm taking the pill, so why is my pressure still high? Here's the thing. The pill may not be the real problem. The routine around the pill often is. And by the end of this video, you'll know the 5 common mistakes that quietly keep your numbers up and what to do instead. Now, before we continue, tell me your age and where you're watching from in the comments. This helps us understand who we're helping. Here's what most people get wrong. They think blood pressure medicine works like flipping a light switch. Pill in, problem gone. But that's not how it works. Blood pressure medicine is more like a good helper, not a bulldozer. It helps your body do its job, but it still has to fight against salt, stress, missed doses, poor sleep, pain pills, and long hours of sitting. And sometimes the reading itself is wrong. A 2023 study from Johns Hopkins found that using the wrong blood pressure cuff size gave strikingly inaccurate readings. In people who needed an extra large cuff, a regular cuff pushed the top number, the systolic pressure, up by 19.5 points. Think about that. You could look uncontrolled on paper when your cuff is the real problem. That's like weighing yourself on a broken scale and blaming your dinner. There's another shocker. A 2023 program from the University of Manchester found that nearly 1/3 of patients were not taking their blood pressure tablets regularly. Even more important, over 50% became fully adherent, which means taking the medicine as prescribed after the problem was identified and their blood pressure dropped considerably. So no, this is not always about needing more medication. Sometimes it is about removing the daily mistakes that cancel the medicine out. Number 5, taking your medicine on an unpredictable schedule. Most people think the big secret is morning versus night, but actually the bigger issue is consistency. Your body likes rhythm. Your blood pressure medicine likes rhythm too. When you take it at random times, skip days, or double up after forgetting, you turn a steady helper into a confused backup worker. A 2022 study from the University of Dundee followed more than 21,000 patients and found that taking blood pressure medicine in the morning was not better or worse than taking it in the evening for preventing heart attacks, strokes, or vascular death. Let me be clear, the best time was the time people could stick with. That matters because a 2023 program from the University of Manchester found nearly 1/3 of patients were not taking their tablets regularly. Why does this happen so easily? Because blood pressure usually does not hurt. It's called a silent condition for a reason. If your knee hurts, you remember the pain pill. If your pressure is high, you may feel nothing. So your brain says, I'm fine today, but your arteries, the blood vessels that carry blood, do not agree. Think of your medicine like watering a plant, not once a week, not whenever you remember. A little steady pattern works better than random floods. So what should you do? Pick one anchor you already do every day. Brushing your teeth, feeding the dog, making your morning coffee. Put the pill where that habit happens as long as the spot is safe and dry. Use a weekly pill box. Set one alarm, not 5. Refill your prescription 7 days early, not the day you run out. If you travel, keep one backup dose container in your bag. And never change the time or dose on your own without checking with your doctor or pharmacist. If one pill makes you urinate more, that may be a diuretic, a medicine that helps your body get rid of extra salt and water. Many people do better taking that earlier in the day, so they are not up all night. But again, ask your doctor before changing the schedule. And if you ever miss a dose, do not guess. Read the label or call your pharmacist. Doubling up can sometimes drop your pressure too low. That can leave you dizzy, weak, or even cause a fall. But wait until you see number 4, because this mistake shows up on healthy plates every single day. Quick question, have you ever missed your blood pressure pill and then seen a higher reading later? Comment yes or no below. Number 4, eating far more salt than you realize. Most people think they only eat too much salt if they use the salt shaker. But actually, most sodium, which is the main part of salt, comes from packaged and restaurant foods. It hides in bread, canned soup, deli meat, sauces, frozen meals, and even foods labeled light or turkey. A 2023 study from the University of Alabama at Birmingham, Vanderbilt University Medical Center, and Northwestern Medicine found that 70 to 75% of participants lowered their blood pressure when they reduced sodium. Overall, 72% saw their top number go down on a low-sodium diet, even if they were already taking blood pressure medicine. And this happened in just 1 week. Why is salt such a problem? Because sodium acts like a sponge. It pulls water into your bloodstream. More water in the pipes means more pressure on the pipe walls. That is your blood pressure, not magic, just pressure physics inside your body. Now look at how sneaky this gets. 1 cup of canned soup can have 700 to 900 milligrams of sodium. 2 slices of bread can add 240 to 400 milligrams. 2 ounces of deli turkey can bring 500 to 700 milligrams. A fast food breakfast sandwich can jump past 1,200 milligrams before noon. And many people with high blood pressure are told to aim below 1,500 milligrams a day. See the trap? You can hit the whole day's limit before lunch and never touch the salt shaker once. So what should you do? Start with labels. Compare brands. Choose foods with 140 milligrams of sodium or less per serving when possible. Buy no salt added beans, which may have as little as 5 to 15 milligrams per serving instead of hundreds. Pick plain oatmeal over flavored packets. Use lemon, garlic, onion powder, black pepper, vinegar, and herbs instead of salty seasoning blends. Rinse canned beans and vegetables. That simple rinse can wash away part of the sodium. If you eat out, ask for sauce on the side. Split large portions. And if you love soup, make a big pot at home and freeze it in containers. Here's the thing. You do not need a perfect diet overnight. Even moving from very salty to less salty can help. That is what the study showed. But wait until you see number 3, because this one can raise your pressure even if your meals are clean. Number 3, taking everyday pain or cold medicines without checking them. Most people think over-the-counter means harmless. But actually, some common pain relievers and cold medicines can push blood pressure up or make your blood pressure medicine work less well. This includes some anti-inflammatory pain pills, some decongestants, and even regular long-term use of acetaminophen, also called paracetamol in some countries. A 2022 study from the University of Edinburgh looked at 110 patients with a history of high blood pressure. People taking 1 gram of paracetamol 4 times a day for 2 weeks had a significant rise in blood pressure compared with placebo, which is a look-alike inactive pill. Experts said the increase could raise the risk of heart disease or stroke by around 20%. That surprises many people. They avoid one pain pill and switch to another, thinking they are in the clear. But blood pressure does not care about marketing. It responds to what the drug does inside your body. Some pain relievers make the body hold more salt and water. Some tighten blood vessels. Some cold medicines act like a squeeze command to your circulation. That is the last thing you want when your numbers are already high. So what should you do? First, read the active ingredients, not just the brand name. Many sinus, cold, and flu, and PM products are mixes. Second, bring every bottle you take to your next appointment. Prescription pills, pain pills, sleep aids, herbal products, everything. Third, ask one simple question. Could this raise my blood pressure or interfere with my blood pressure medicine? That question alone can save months of frustration. If you have chronic pain, ask about non-drug options too. Heat, physical therapy, stretching, walking, better shoes, weight support braces, mattress changes. Sometimes the goal is not take nothing. It is take the safest option for the shortest time needed. And do not forget the daily extras. A large energy drink may carry 150 to 200 milligrams of caffeine. Some people handle that fine. Others see their pressure climb. Your body will tell you. You just have to measure and notice. Before we go further, if this is making sense so far, hit that like button. It tells me you want more videos like this. Number 2, sitting too much and moving too little. Most people think exercise only helps if it is hard, sweaty, and done in gym clothes. But actually, your blood pressure responds to simple movement more than most people realize. Your arteries are like a garden hose. When your body stays still all day, the hose gets stiff. When you move, the hose stays more flexible. A 2023 study highlighted by UCNNO, working with researchers at Iowa State University, found that older adults with hypertension who added about 3,000 steps a day lowered their systolic blood pressure by 7 points and their diastolic, the bottom number, by 4 points on average. Those changes were linked to an estimated 18% reduction in heart disease risk and a 36% reduction in stroke risk. And yes, some of those adults were already on blood pressure medicine. That is powerful. Not because walking replaces medication for everyone, but because walking can make the treatment work better. Think of it like this. Medicine removes some weight from the pressure system, and movement helps the whole system flow better. Not either or. Both. So how do you do this if you are over 60, tired, busy, or dealing with bad knees? Make it smaller. Walk 10 minutes after breakfast. Walk 10 minutes after lunch. Walk 10 minutes after dinner. That alone can get you close to 3,000 extra steps. If weather is bad, walk your hallway, your driveway, the grocery store, or even around your living room during commercials. If walking is hard, do seated marching for 2 minutes. Stand up and sit down from a chair 10 times, or hold the kitchen counter and do slow heel raises. Movement snacks work, little bits still count. And do not wait for motivation. Use triggers. After coffee, I walk. After lunch, I walk. After the evening news, I walk. Habits built onto old habits last longer. But wait until you see number 1, because this one ruins blood pressure control while you sleep. I'd love to hear your story. What made you click on this video today? Share in the comments. Number 1, treating sleep and alcohol like they do not matter. Most people think one bad night of sleep or one evening drink cannot change much, but actually, poor sleep and regular alcohol can quietly keep blood pressure elevated, even when medication is on board. And this is where many people get fooled, because the damage happens in the background. A 2023 study co-authored by researchers at Tulane University found that even low daily alcohol intake was linked to rising blood pressure over time. Just 12 grams of alcohol a day, about one 11-ounce beer, was linked to a 1.25 millimeters of mercury increase in systolic blood pressure. At 48 grams a day, systolic pressure rose 4.9 millimeters of mercury. So if you tell yourself it's only one drink, understand that your blood pressure may still notice. Now add poor sleep on top of that. A 2019 study from the University of Utah found that extending sleep by just 30 minutes produced blood pressure improvements so strong, the researchers said the effect was as big as taking medication. Read that again. 30 more minutes, not a miracle, not a supplement. Sleep. Why does this matter so much? Because during good sleep, your body is supposed to lower the pressure for a while. It is like nighttime maintenance for your heart and blood vessels. But if you sleep badly, wake often, snore loudly, or use alcohol to knock yourself out, your body may miss that repair window. Alcohol can make you sleepy at first, but it often breaks sleep later in the night. So you doze off faster. Then your body pays for it at 2 a.m. And if you snore, gasp, choke, wake with a dry mouth, or feel exhausted even after 7 hours in bed, talk to your doctor about sleep apnea, which means breathing repeatedly stops during sleep. Many people do not know they have it. Their partner knows. Their blood pressure knows. They do not. So what should you do? Try finishing your last drink at least 3 hours before bed. Better yet, have several alcohol-free nights each week and see what happens to your morning readings. One standard drink is about 5 ounces of wine, 12 ounces of regular beer, or 1.5 ounces of liquor. Keep a simple sleep routine, same bedtime, same wake time. Dim lights 1 hour before bed. No scrolling in bed. Cool, dark room. If you snore hard or feel worn out every morning, ask about a sleep study. Do not brush that off. It may be the missing piece. Your medicine cannot fix what your sleep keeps breaking. Let's pump the brakes for a second. I'm not saying this to scare you, but you should never stop or change your blood pressure medicine on your own just because one of these mistakes sounds familiar. Fix the habit, yes, but work with your doctor or pharmacist before changing the prescription. Some blood pressure medicines lower potassium, others raise it. Some mix badly with dehydration. Some can make you dizzy if your pressure falls too fast. And if you have kidney disease, heart failure, or diabetes, the best plan may be different for you. Watch for warning signs too. If your pressure is repeatedly very high at home, if you feel chest pain, shortness of breath, severe headache, confusion, weakness on one side, fainting, or vision changes, get medical help right away. And if your home reading is 180 over 120 or higher, especially with symptoms, do not just sit there hoping it passes. Get urgent help. Also, bring your monitor to a clinic visit once in a while. Make sure your cuff fits. Sit with your back supported, feet flat on the floor, arm resting at heart level. No smoking, coffee, or exercise for 30 minutes before checking if you can help it. Then rest quietly for 5 minutes first. Small mistakes can create big confusion. So you're convinced, but thinking, how do I actually do this? Start simple. First, take your medicine at the same time every day using one anchor habit and a weekly pill box. Second, cut one major salt source this week, Just one. Maybe canned soup, maybe deli meat, maybe restaurant breakfast. Third, add one 10-minute walk after one meal every day. If you can do more later, great. Fourth, give yourself 2 alcohol-free evenings this week and see how your morning numbers look. Fifth, protect your sleep like it is part of your treatment, because it is. If money is tight, keep it basic. Frozen vegetables are often cheaper than fresh and just as useful. Dried beans cost less than packaged meals. Plain oats are cheap and low in sodium. A simple pill organizer costs less than a takeout meal. Walking is free. A notebook for blood pressure readings is cheaper than any gadget. You do not need a fancy routine. You need a repeatable one. Look, there's a lot of noise out there. Too many people are told their blood pressure is just bad luck or that they simply need more pills forever. Sometimes that is true, but many times the real issue is simpler than that. You do not need to overthink this. Start with just one fix you know you can keep for the next 7 days. Your body will tell you if it's working because your numbers will start to show it. If this helped you, hit that like button. And if you want more videos like this, make sure you're subscribed because we post new health tips every single day. Stay healthy, stay strong.